Well, we're here at the AVPN Global Conference 2025 in Hong Kong. And right now I'm here with Dr. Ayoade Alakija, the chair of FIND, which is a foundation for innovative new diagnostics.
Yes.
Did I get that right?
Yes, you did.
And the co-chair for the Impact Investment Initiative for Global Health. Welcome.
Thank you. It's wonderful to be here.
Well, for a start, that's a handful. How can you do all of that?
I don't know. It's a simple answer, and it is more than a handful.
Yes.
But I am incredibly blessed and lucky to have such responsibilities. My core mission is humanity, and both those things allow me to input into the betterment of humanity from different angles, one from a purely health perspective and the other one from an investment and investing in health perspective.
Well, let's talk about FIND,
Yes.
first of all. So tell us about the foundation and, what you are doing there. Because we've just been through, and it feels very recent, the COVID pandemic, of course, and that's all part of, what we need to be working on. Are we ready for another one? All of those sorts of questions. Tell me about FIND.
Well, you talk about pandemic. FIND is, as you say, focused on diagnostics,
Yeah.
and most of the tests really that the whole world used during COVID were validated, and they were the clinical trials for them came out of us. So FIND was the organization, the diagnostics pillar that was the lead during COVID out of Geneva. So you introduced me by two of my titles. The other thing that I do is I'm the WHO Special Envoy for the Access to COVID Tools Accelerator. And what does that mean? That means that during COVID, we were the ones who basically did the research on which vaccines, which tests, which treatments. We were the ones who validated. This was, I chaired every Thursday during COVID, the big nine as I call them. And who were the big nine? The top leaders of global health in the world, which was the head of WHO, Dr. Tedros, the head of Gavi at the time, the head of the Global Fund, the head of the Wellcome Trust. And they were all men. So I called them all my 9 brothers, and there I was, this silly girl who was chairing this meeting. But it was incredible to see that. And FIND was a part of that. FIND was the diagnostics arm. The world talks a lot about vaccines, but we've forgotten that, you have to be able to test before you can treat. You have to be able to detect diseases. You have to be able to do screening. We have a silent pandemic at the moment of antimicrobial resistance. And another hat that I wear is that I'm Nigeria's Ministerial Global Envoy for AMR. The antimicrobial resistance, which is, what does that mean, you say? It is this, basically the parasites, the fungi, the bacteria have stopped responding to the drugs that we have. And you're now seeing a lot of people dying from sepsis and things, particularly in hospitals all over the world. And if we don't have tests, people are overusing antibiotics. If you don't have tests, a mother who goes to a healthcare clinic in rural Cambodia, say for instance, her child has a fever. She doesn't know what the child has. It is possible that she will be given a whole cocktail of antibiotics, just, hit and miss. You get given a bag, say, go try these. But it perhaps is just a viral illness. And had she had a simple rapid diagnostic test in that center, it would save her having to put her child through all of that, but also save the environment and save lives further down the line.
So how do you get into those remote communities and the remote villages that just don't have access to any of these kind of diagnostics?
Oh, I love that question. That's perfect. And that is the thing. We work in FIND, we work on the research and development, we're based out of Geneva, which is the head office, which I hope, the whole world needs to de-Geneverize because it's expensive, it's in the middle of Europe, and the people who need those tests really are in other parts of the world. So we need to start there, but that's a whole nother conversation. I'll come back for that interview later. But how do we get to the rural communities is perfect. And part of what we do R&D, we also do access. And access means working with local groups, and we have offices in Indonesia, we have offices, my largest office is in India, working with local groups and local communities to reach the people where the help is most needed. And that for me is the core mission. And of course in Africa as well, which is, I'm part from this region because my husband and daughter are Fijian, so I call myself, part from the Western Pacific, Asia Pacific region, but I'm also a Nubian princess, as I say, from Africa.
Which is beautiful.
Thank
We'd
you.
love to have that combination. But on the ground, you understand, this is obviously, it doesn't matter where in the world you are, there are still rural communities that don't have access to the healthcare that they need.
It's not just rural communities. I mean, in Abuja, which is where I live in Nigeria, if I want a test, now let me go back to COVID.
Yes.
So in Nigeria during COVID, the only way you could get a test was a PCR, and it cost $150 US dollars. The minimum wage, exactly.
You can afford that.
I mean, the average wage, most Nigerians are still existing on less than $2 a day. There were no rapid diagnostic tests. So that led, in my mind, in many parts, not just Nigeria, many parts of the world, to the development of the various variants that we saw. And it was the, School of Public Health that said if you don't test, it doesn't exist. So when the vaccines did come to some of those countries, people wouldn't take them because whilst you're watching the ticker tape go off on CNN or whatever it was of X number of cases today, in our countries the cases would be 10 because the only people who could afford a test and the only reason to take a test was if you were trying to travel. Who can afford that? So when the vaccines then came, people said, well, I'm not taking a vaccine because it doesn't exist in this country. It's something that is in America. So it's not just in rural communities. I mean, my city, Abuja, if I have a fever and I go to a pharmacist because primary health care is limited, what I get is a bag of antibiotics.
Yes. Yes. So let me ask you then, what about your second role that we're talking about? Now we're talking about the money and channeling the money into where it needs to go.
Yeah.
What does that look like? I mean, how do you do that? There is such a big funding gap when it comes to the needs that we have around the world, whether it's climate change, whether it is global health. How do you get the money that is required?
Well, climate change, global health, as we talk these days about One Health, number one, they're all wrapped up into one. We're seeing the effects of climate in health very strongly right now. So I think, first of all, one of my favorite new words that I've made up is we must desilarize. Because everything is in silos. We need to desilarize the work that we do. And once we desilarize, we start cutting out the waste and we start beginning to see greater return on our investments. So III is about bringing more private investment into global health. And I've just had a conversation, as I just told you, with the most wonderful Right Honourable Helen Clark of New Zealand, who I call Auntie Helen, who, is very much a proponent of global health as a public good, which I also agree with. But I also think we need to balance it also with private investments. We need to do both. It's not an either or, it's a both and. And in bringing investments into health, people often will say, oh, what is the return on that investment going to be? And my answer as somebody who's core humanitarian would be, well, first of all, the fact that you're saving lives, the fact that a girl can go to school, because we can think about the broader social determinants of health. It's not just the prevention of disease. It is wellness. It is well-being. It is the fact that a girl has the periods, sanitary periods, so that she has dignity and she's able to go to school. It's about the fact that we're not marrying girls off, when that's not marriage, when they're 12. We're just selling them off into sex slavery, really. I hate it when people say child marriage. It's not marriage. It's just raping children. And so how do we ensure that we invest properly as a global community, and that we find all these wonderful bigwigs that are here this week and billionaires, that they put money into these programs that save lives, protect people's dignity? For me, it's largely about women and girls.
I wish we had more time. We could spend all afternoon talking about this. But thank you so much for coming and sharing this with us. It's been a real pleasure.